Hello, I'm Julia Walters with Kingman Regional Medical Center, and you're watching our COVID-19 update series. In the last week, we've tested 554 patients for COVID-19 with 31 positive results. We currently have 16 patients in-house related to COVID, and our rolling percent positivity rate for the last 7 days is 5.64. Our percent positivity rate is coming down consistently, which leads me to our topic for today. Today we have Will McConnell here, our President and CEO, to talk about our flexible visitation policy. Our policy restrictions will depend on the positivity rate for the previous week. Hi Will, thanks for being with us.
Thanks for having me.
Okay, can you tell us a little bit more about this visitation policy that we have implemented?
Several months ago, when we reinstituted visitation, we made a commitment to remain open for visitation regardless, because we feel strongly that patients' healing is helped by their family members being present. So with the percent positive coming down, the criteria that we settled on was if the rolling 7-day average is below 5%, it's essentially 8 to 6 p.m., open for a round-robin visitation where different members of the family can visit. If it's between 5 and 10%, which would be yellow in status, then it's one person during that time frame, but still 8 to 6 p.m. And then if it's above 10% positive, that's the red category. And in that situation, the visitation is restricted to the hours of 8 to 10 and 4 to 6 p.m.
So this whole policy is an effort to reduce the transmission of COVID while
Correct.
Still allowing for safe visitation. So how does this apply to patients in isolation or with COVID-19?
Good question. So with COVID-19 or in the isolation, the current standards still apply. That visitation is directed by the physician taking care of that patient. And we do try to allow that, but it's a lot more restrictive when it comes to the actual ability to visit a COVID positive patient.
Right. Okay, so moving on, at the beginning of this month, we had an Air Force medical team show up to KRMC
Correct.
to support our staff. Do you want to tell us more about that?
Yeah, so after the recent surge that really hit us the end of December and most of January, we requested assistance from FEMA to give our staff some much needed relief. So that group has been here since the first part of this month, and they'll be here through the end of the month. And that group consisted of 20 RNs, 14 on the med-surg floors, and 6 in the ICU, as well as 4 respiratory therapists, and the subsequent military personnel to help support that deployment. And it's been a huge help relative to when you think about the last year and how much stress and how much effort has been placed into taking care of patients. Having these folks here to give us a little bit of a break has been really well received and has been a much needed break.
And that is great. So now we're able to return some of our redeployed staff to their home units.
Through the most recent surge, we had respiratory therapists who were working in quality redeployed to the floors. And so this has also allowed us to return those redeployed staff to their home department and has really allowed us to focus on some of the operational work that had been sacrificed to really make sure that we take care of our patients.
Finally, I want to address the status of our vaccine clinic quickly with you.
Thank you to all of you who have called the vaccine hotline in an attempt to schedule an appointment. We've received a high volume of calls and just want to let you know that we're actively working through those, and thank you for your patience.
Great. Thanks, Will, for being with us today.
Thank you.
Thank you for watching our COVID-19 update series. For more information about our COVID response, visit our website at azkrmc.com. If you have questions you'd like us to address in these videos, please email us at share@azkrmc.com. Until next time, stay safe and healthy.